90.3 FM. Hey, it's 10:58 a.m. And of course, I told you that Doctor will be with me today again, being Thursday, the 27th day in the month of November 2025. He is here already. All right. Well, according to some, they say he's Agba Doctor. Like I used to call him. When I want to yab him, I just when you call him Agba Doctor, he will laugh like he's doing right now. You can get to YouTube and watch him live, okay? Agba Doctor is just right here in the studio with me. He is Dr. Charles Arogundade Adeoku. Dr. Charles, good to have you.
Good morning. Yeah, good to have you too.
Is that your middle name, actually?
Yes. Yes, there is. There's a middle name.
Yeah. Doc, good to have you once again. Everyone, join the conversation quickly. YouTube is there. WhatsApp is there. We don't take calls on this show. Just make sure you stay right there because we want to touch on something we've discussed earlier. All right, but I kept hearing, complaints from people. They want us to kind of visit these again and again and again because, when it comes to learning, it's never enough. Knowing is very important. All right, education is key. All right, and that's why we want to look at these again. What am I talking about? I'm talking about sexual health, not in marriages alone now, generally, because I understand some persons are not married, yet they are supposed to be married. Some are above 50, they're not married. One would know the reason why such persons are not married. Some above 40, not married. Some above 30, they're not married. And some above 25 and they're not married. Some are having one issue or the other. Some are just, let's just stay like that. Best way no marry, go still go heaven. That's what they'll tell you. All right. But especially for those persons who are having some issues or the other, health-wise. All right. And we know it's tied to sexual health, your health, sexually. Maybe that's the reason why you're passing through some of these things you're passing through. Sometimes you want to go to a hospital to find out what's wrong with you. Sometimes some of us just abstain from the hospital. I want to do the traditional style because you're told that if it happens this way, if you're getting this ABC symptoms, then the best way to go about it is to employ a traditional means or a traditional way and all of that. So there are a whole lot of questions. In fact, I had a conversation with two persons. I'm actually coming up with this issue, this topic. We call two people who I know are listening to us right now. All right. I wish we could just, we could have around 2 or 3 hours to flog this very well, but that's not possible at all. We just have 1 hour to do so. But then I would ask you to get very close to your radio set. And let's have a beautiful conversation. Hey, don't forget to send in your messages immediately because I want to be taking messages as soon as possible. Just send in your messages to the number 081 717 56338. I'll take that number again. It's a WhatsApp number 081 717 56338. I don't take calls on this show. I will only read your messages. All right? Okay. Dr. Charles Adeogu is just right here, and let's start. When we say sexual health, some persons really don't understand. When you say mental health, some will say, oh, yes, I understand. Mental. And it's about sexual health. What's up with it? What is it I have to know? I know when I do the ABC, I have to clean up, I have to take care of myself, I have to take this drug, before. Some will say before my menstruation, after my, and all of that. So there's just this question around sexual health. But I would want you to help us break it down. Help us understand what it is when we say sexual health in marriages or outside marriage.
Okay, thank you. So sexual health refers to that aspect of health, because health is like a canopy. It has a lot of things under it that it covers. So sexual health is that aspect of health that relates to reproductive health, sexual intercourse, and all the problems that are associated with it, sexually transmitted infections, all come under sexual health, unwanted pregnancies, contraception, family planning, everything comes under sexual health. Yes, because sexual health is also broad. So when you talk about sexual health in men and women, there are different facets to it.
Okay.
Part of the sexual health of a woman, she will talk about her reproductive system, she'll talk about her menstrual cycle, she's going to talk about her ovulation, she'll talk about pelvic inflammatory disease or sexually transmitted infections. All these, one way or the other, are related to sexual health. So basically, it's something that relates to men and women, adolescents, young adults, the youth in general, because basically these are people that are within the age bracket that are sexually active, and it's very good for them to be armed and empowered with the knowledge they require to make the best decision for themselves when it comes to their sexuality, because it's an inherent part of every human being, and ultimately it comes with consequences of your decisions, consequences of the actions you take. So like we've been talking about in the last couple of episodes, we've been talking that trying to emphasize that young adults and adolescents should be well educated, and they should have a good idea of their bodies, how their bodies function, how their bodies work, and that there are consequences for actions taken. Because if they are not armed with this information, it's only a matter of time before they run into errors. And most of the mistakes that people make relating to sexual health, now emphasizing on the female gender, is usually very, very life altering. Because you can imagine a child or a teenager who is in school that's is not properly informed, and something happens, teenage pregnancy results, she has problems and complications relating to pregnancy. Education automatically stops, her career is interrupted, and there are lots of things that go wrong. And even if she goes successfully throughout the pregnancy and she has a child, and even if she gives that child to her mom or another adult who is able to care for the child while she continues her education, she already has a mark that is indelible, that cannot be wiped off, because ultimately later in life, when she intends to settle down, she already has a child from somewhere, and that would also determine what kind of man she's probably going to settle with, and would it's a ripple effect. It goes on and on and on, and one effect or the other now starts coming up. She's now starting a new family, but with an extra baggage from her past that has refused to go away. So it's very important that appropriate knowledge is and attention is given to sexual health, particularly to young adults who are beginning to transition from childhood to adulthood, because they are so naive, they are open to experimentation, there's peer pressure, they want to feel cool, they want to fit in, so they may be pressured to do certain things that they do not know, or they are not fully aware of the consequences that may follow such decisions. So it's important that we talk about it in schools, talk about it first in the family, then in the schools, then in the religious institutions, then in the communities. Let us be more open about such discussions. Let us remove the shame and the stigma or the awkwardness of such conversations, because you can help a youth, you can help a young person make a right choice just by a healthy conversation, and letting them know that whatever they are feeling or whatever their questions are, they are valid, and give them the timely advice they need before they make an error that can actually taint their future or affect them adversely in future.
One side I want to tilt this discussion towards is healthy marriage and, of course, sex life. You get healthy marriage, sex life. It's like the part 2 of what we discussed last time. That's why I want to look at another different area. some persons will tell you that, because I know there are thousands of persons listening to us right now, married people. Some have argued that healthy marriage doesn't have anything to do with your sex life. Whether your sex life is good or not, it does not add to whether your marriage is healthy, beautiful, wonderful, or not. This is the side I want to go. How would you look at it? Healthy marriage and, of course, sex life. How would you look at it?
Okay, well, marriage, which is a union between a man and a woman, that conjugal, union is basically for companionship, first and foremost. Then, aside companionship, then comes the idea of procreation and building a family together. Because when two people get to meet each other, there are so many factors to consider in the choice of a life partner. I once heard somewhere, somebody said, after the choice of the God you serve, the most important decision you will ever make in your life is the person you spend the rest of your life with. So that decision is not a joke. That decision is a very big one. It's also a life-altering one. It alters everything about you. If you meet the right person, you have heaven on earth. If you meet the wrong person, you have the opposite. Some people have gone to their early graves because of wrong decisions and wrong marriages. Some people are frustrated. Some people, they've had one or two things go wrong for them because of the choice of the person they chose as their spouse. But the sexual union in marriage is a bonding that is not just physical bonding, it's also emotional and spiritual bonding also, because it is that kind of intimacy that lets the two parties, unite and know each other completely.
All right.
And which ultimately results in the production of new life. So, of course, it is a very vital part of it, but it is not completely based on that alone. Because what happens where you have a happily married couple and life happens to them and there's a disaster, there's an accident that has affected the other person such that the other person may not be able to have a vibrant sexual life again. Does that mean that marriage has automatically ended? Well, we're going to say that's a fundamental part of the marriage is affected, but that is not the only basis for the marriage. That is why we always tell people too that sometimes, you don't read meanings too much into things, and you don't let societal pressure push you, to make certain decisions. That's why in some families you find couples that because they cannot have a child, to them, especially for the man or his family, what is the point of the marriage when you cannot produce a child? So to imams, to people who even have no business putting their mouths or any interference in the marriage, everybody seems to have an opinion, and they bring all this into the marriage, further ripping the couple apart.
Okay.
So it's important for the couple to know, first and foremost, that they are in there for each other, to enjoy each other's company, for companionship first, and every other thing that comes with it is a blessing and an addition, and not the basis or the fundamental for that marriage in the first instance. So it's clear that this should be clear, in the minds of, people who are getting married or newlyweds, because when they are asking you to exchange vows, the vows is just between both of you.
Okay.
With God as your witness, and no other person is involved.
Of course.
So you started the marriage, as two of you alone. Then the additions come in, and then after a while, even the additions will grow up and then fend for themselves and go their separate ways, and you are left as a couple all again in your old age. So it is only both of you that are in that marriage essentially, and the earlier you understand that, the better. So external factors, pressures from outside, external influences should be minimized if you want a happy and successful marriage.
Okay, thank you so much. My question this morning might come in from different angles, and I trust Agba Doctor will do justice to it. Right now, before I talk about STIs and STDs and all of that can affect childbearing, I'm getting plenty questions already, right? I would help this guy ask this question because it's kind of tied to what I wanted to ask. Because I especially want to pick this question first. He said, "Good morning, Doc. I'm Tobechiku from Lagos Island. Please, is masturbation, or does masturbation do harm or cause any harm in our body system?
That's a very important question, because we have this question come up time and time again. So masturbation is essentially the process or the practice, the habitual practice of one stimulating one's genitals and arousing oneself to the point of climaxing. That is what masturbation is essentially. So it's a form of self-play, and it has a lot of emotional and mental aspects to it, because fundamentally when you are masturbating, you are using your mind, you are using your body and your imagination, to create whatever you are creating. But it's very important for you to know that it comes with a lot of addiction associated with it. A lot of people cannot break away from the habits because it's something they've indulged in time and time again. But it really does have some psychological effects and some effect that can affect your relationships. Let me put it that way. But when it comes to bodily effects, well, minimal, but not completely zero. So let me break it down. First and foremost, these are the things that you can experience when you masturbate too frequently. When you masturbate too frequently, after a while, your body, just like your body tolerates things and gets used to things, your body gets used to that method of stimulation, and it is only that method of stimulation that can actually arouse you or give you sexual satisfaction. So you now find out that because it's something you do habitually, and some people get so addicted to it, you may even prefer it to the real intimacy sometimes.
Okay.
And then aside that, the dopamine surge, the feel good feeling that you have, it comes to a stage that if you cannot replicate that scenario with a partner, then you are not going to get sexually aroused. That's why sometimes some people who masturbate too frequently may also have symptoms that are suggestive of erectile dysfunction when they are with a real partner, because they are not going to be stimulated the same way they've been used to being stimulated. And another thing that comes with masturbation is that masturbation is strongly associated with pornography. It's closely associated with pornography because you're using your imagination, images, pictures, and all that. And then you find out that people that masturbate sometimes also do a lot of pornography. And when you do pornography, the level of stimulation that you derive, that your brain has, the level of excitement or excitation that you give your brain, in real life your partner may not be able to produce that kind of stimulation for you. So your expectations are not met, and at the end of the day you find out that because you're always used to that level of being high or excitement to thrill you, then you're not going to find your partner worthwhile. So at the end of the day, your partner has questions to ask. Is there a problem? Maybe you don't like the person anymore. Is something going wrong in the relationship? Is there problems with intimacy and all that? But you wouldn't know that it is actually from your own habitual, practices like masturbation and pornography that has given you that kind of, high level of excitement and expectations that your partner cannot reproduce in real life. Then also you can also find out that some people, because of vigorous masturbation or without lubrication or whatever, may now start having their skin get calloused, because anywhere you have friction all the time, you can actually form the skin over there starts thickening up, and then your nerve endings may be less sensitive. Then you may lose sensitivity, and once you lose sensitivity to, of course, that affects your arousal and your level of stimulation. So all these are factors that are really, really big issues, when it comes to relationships. So it affects the way you see your partner, it affects the way you relate with a real person, because you are now more of somebody who is in your mind and in your imaginations most of the time, and then most of these things can't be replicated in real life. So you find out that it's a problem.
If you're just joining us, I said you can send in your messages, any message. Send your messages to via WhatsApp now. It has to be WhatsApp alone. 081 717 56338. I said 081 081-717-56338. Okay, thank you. For some reasons, I want to, I don't know what Doctor's Mic will be like after today, but then I want to put aside all my questions to you this morning, and I want to ask questions from listeners. All of them. I want to see how possible I can treat. I can read out questions. This morning on the show. All right. So it's just going to be questions and answers this morning. All right. But please make sure your question is direct and brief. Thank you so much. Getting several questions already. 081-717-56338 is the WhatsApp number. 081-717-56338. Thank you so much. Okay, now doctor, let's get to it. I'm in my 40s. Please. My BP has been going up for some months now, and my cholesterol is high too. All right. My doctor gave me drugs for it, but I'm just being scared to take them because of the negative complications that may affect my sexual life. Please, is there any BP drugs that can make one to that will help that will not affect my sexual life? That's what this guy is asking. A BP drugs that will not affect his sexual life, because it's guiding that place jealously.
Okay, very good question. First and foremost, we've talked about hypertension time and time again on this show. Hypertension is a silent killer, and you cannot run away from your drugs. It's a long-term treatment, so that means that you cannot stay away from your medications. Once that diagnosis has been made that you have high blood pressure, you need to control it. And cholesterol being high is not in your favor, because it increases your chances of other cardiovascular events like a heart attack, like a stroke. You don't want any of those things. So please, yes, there are different classes of antihypertensives. There are some that have been known for that kind of side effect, but you can talk to your doctor. There are different classes that you can choose from that would have minimal effect in that regard. Yes, you have diuretics that you need. Diuretics are those classes of antihypertensives that will make you pee more, shed off excess fluid, and some of them do have this effect. But talking to your doctor and having a good dialogue on what is best for you to take is doable. So I advise that you see your doctor, and your doctor will tell you all the various options that are available, and then you can safely choose from them. But for your cholesterol, very important that you're on your medications, and please don't go by that initial thing you said that you're so concerned about the side effects. The truth is, there's no drug that has zero side effects. That is the truth. If you are waiting for a drug that has absolutely no side effects, it does not exist. But the best thing is, the rule of thumb we use as doctors is that if the benefits you are to derive from the drug outweighs the side effects, then you should take it, because those side effects are minimal compared to what will happen if you leave your blood pressure uncontrolled. Because you know what stroke is, you know what a heart attack is, you know what sudden death is, you know what a kidney failure or kidney problem is. Those things are nothing compared to the side effects you may be running away from. So we need to be wise in making our decisions. That's why you need a medical practitioner to guide you and advise you on your choices, so that the one that suits you the most and that would not give you the undesirable effects will be chosen for you.
Okay, thank you. Are there organizations that subsidize drugs? Because high cost of drugs has made people to manage their health poorly. The eye drop I used to buy for 3,500 is now 20k, and is affecting my eye management. Please, or rather, plus other drugs I'm using is affecting the. This is Madam Florence speaking.
Well, the truth is, there are many factors that determine the prices of drugs. First and foremost, we are not a manufacturing country, so to say. We have indigenous pharmaceutical companies, but they may not be able to make all the drugs that the population needs. So a lot of our drugs are still gotten from outside the country, and what the exchange rates, what the values are currently. So of course that would also influence the cost at which they are sold to you. And then secondly, when it comes to your treatment, especially when you are managing any illness that is long term, that we term chronic illnesses, these are illnesses that continue going long term and you have to be on treatment. You actually have little choice, especially when you are on a medication that is working for you.
Okay.
If you're on a medication that is working for you, the best advice is that please, you should stay on that medication, because if you go for another option or you seek other alternatives that are not as effective, you'll be shooting yourself in the foot, because you'll find out that you're spending money, you're wasting time, and your condition is deteriorating. So the best you can do is, we just have to hope that God keeps blessing us and we have multiple streams of income to meet up with,
to help ourselves.
Exactly. So that when the need arises for us to pay for something relating to our health, we'll have money in our pockets to do so.
It's okay. Let's get to the next question here. Good morning, doctor. I put to bed 5 months ago. I don't have sexual urge, please. What can I do? Why and what can I do? No sexual urge after 5 months.
Well, it's not impossible. You may be you have a newborn in your hand, you may be sleep deprived, you may not be sleeping well enough. Your baby cries, your baby makes a move, you're already awake, you wake up in the nights to feed the child and all that, you change diapers. That amounts to stress. And when you are stressed out, yes, you may not have the urges like you should, because you have to be well relaxed for your hormones to balance up and for things to work the way they should. For most nursing mothers, sleep is a problem. So sleep becomes a luxury for them, because they're always watching out for their kids. And when the babies go for immunization, they get cranky, they are running a fever, all sorts of things come up when you're taking care of a newborn. So it's not unusual for you to feel this way, but you getting enough rest and good nutrition and the right family support, I believe you should be fine. I don't think there's really a big problem.
All right. Let's look at more questions now. Please, is blood pressure medication a lifetime?
Well, hypertension is a chronic illness, so meaning it's a long-term illness that requires long-term management. Yes, the treatment is lifelong. And please, that is not to mean that it is necessarily a bad thing if a treatment is lifelong. Anything that has, a medication that at least can manage it and keep it under control, then count yourself fortunate, because there are many illnesses out there that there are even no treatment available for them, that nobody even knows how to tackle them. We are still not completely wrapped our head around cancer. You've heard of people with all the money traveling abroad and they still die. So if you have something that keeps whatever you're managing in control, count yourself fortunate and adhere to it.
Okay. Recommendation from someone. Good morning, Ikami and Dr. Charles. Dr. Charles, you're very, very sound. All right? You know much about your work, but most importantly, a good counselor. Thank you. This is Apostle Pari Egon Lagos.
Thank you so much, sir. Thank you, sir.
Well, Doc, I'm suffering from blurry vision. Please, what drugs or eye drops can you recommend for me?
Well, if you have blurry vision, it doesn't necessarily mean you need eye drops. You may need to have your sugar checked, because diabetes can present that way. If it's been long standing, you may have blurry vision and you may be thinking you just need eye drops. Get your sugar levels checked. You may visit an optometrist or ultimately an ophthalmologist for a proper eye check to find out if you are having any other thing causing you blurry vision. And I don't know what your age is. If you are advanced in age, maybe you are in your 60s, you may also need to find out if you have cataracts or anything that may be clouding your vision. And it's very important for you to make sure that whatever the findings are when you go for these examinations, please stick to your doctor's advice. If they tell you you need a surgery, please make yourself available. If they tell you need some eye drops, please get it done. And if it is diabetes, we don't pray it is, please stick to the treatment regimen given to you.
I want to ask this question on behalf of Emeka. He said, please, can masturbation lead to weak erection later in life?
Well, the truth is, it is not completely impossible, because You know, when it comes to sexual health, you have the physical, you have the emotional, psycho-emotional aspects to it too. So like we mentioned earlier, when you're used to arousing yourself in a certain way over time, you find out that if you are not aroused that way, you know, you're not going to get the same feeling that you used to get. And we've also found out that a lot of people, from experience, you find out that even in this masturbation, people that confide in you as a doctor will tell you that they use different methods to do this. It's not always the same method. They innovate new ways of doing it. So after a while, you get used to a particular one. It's not giving, you know, that's how humans are. Human needs are insatiable. You know, just like people that watch pornography, after a while you don't like the regular pornography, you now want a pornography that has to do with people tying people up, people harming people hurting people, you know, and then, or people having something to do with children. You know, some very inappropriate things now start coming into play because it now looks like there becomes variety suddenly. So there's diversity in some of these things, and in some of these things you can actually harm yourself both physically and emotionally. And at the end of the day, you find out that you are not getting aroused as much as you can. And mind you, as you get older, depending on your family history or what you have in your family line and on your own diet and lifestyle, you can also develop other conditions that will further cause you erectile dysfunction. We talked about hypertension, diabetes, high cholesterol and all that. And then you are drinking a lot of alcohol, or you're smoking, or you're abusing some recreational drugs. Of course, you know, we've talked about the spike or the prevalence of substance abuse among people now. It's at an all-time high. All this will ultimately affect your erection or your potency as time goes on. So at the end of the day, you find out that anything that is adversely affecting your health, whether in form of masturbation or in form of drug abuse or substance abuse, or not going for regular wellness checks, you'll pay for it at some point along the line as you get older.
Okay. Well, there's this thing I remember to talk about. Someone mentioned the kidney stone everywhere. It's now like one everywhere kidney stone. What's the problem? What's going on? Kidney stone. And hey, I want to talk about the causes, the prevention, and what you should continue doing, you know, to avoid, you know, kidney stone.
Okay, so kidney stones are
doing or stop doing, anyone.
Kidney stones are basically like crystals that are formed in the kidneys, and then, you know, it's a very painful condition, and then you can have some of these crystals, you know, abrasing parts of your kidneys, and then you start passing blood in your urine in some cases, you know. So basically you have different types of kidney stones. You have calcium oxalate stones, you have uric acid stones, you have struvite stones. But basically the simple thing that is common to most people that have kidney stones that they were meant to do that they weren't doing is proper hydration. You know, a lot of people with kidney stones don't drink water enough. We live in the tropics, we sweat a lot, we have insensible water loss through water vapor when we're breathing in and out, you know. And then you see a lot of people, you know, because they don't drink water and give their bodies the water they need, you find out that some of these solutes in the blood, you know, that are in high concentration, you know, they can actually crystallize, you know, and form the stones. So if you're somebody that has high uric acid for different reasons, there are many conditions that can predispose you to high uric acid levels. There are even some medications that can result in high uric acid. People that drink a lot of alcohol, people that eat a lot of red meats can have high uric acid levels. And when you do have high uric acid levels, yes, you will not be surprised when you start forming crystals and stones, uric acid stones. And then for people who take medications without the doctor's prescription, you just go into a chemist, everybody is buying supplements, you're also buying supplements without knowing why you're buying those supplements. You're buying vitamin D supplements that helps your body absorb calcium. You're not vitamin D deficient, but you're swallowing it every day. You're taking a lot of you're also taking calcium. They say calcium is good for your body, you're also swallowing calcium every day. At the end of the day, you have high levels of these things, and they start forming calcium stones. These are the things that happen, and at the end of the day, you find out that these stones, you know, they are really quite uncomfortable, and it's a big deal because the number of stones, their locations, and how much of obstruction they cause, you know, would affect how you manifest. You find out that some people, they start finding out that some portions of their urinary tract is blocked, and then you find the kidneys, you know, swelling up, you know, because of obstruction, and then you find blood in the urine and all that. All these things are quite preventable by simple hydration. taking 2 to 3 liters
Hydration.
taking water, not just any kind of drink, but water itself, because water is the best thing that can hydrate you. You're 60 to 70% made up of water. Even your brain has a large percentage of water, and even if you want your kidneys to work well, you need to drink enough water. So if you don't drink enough water, if you're taking other drinks or fluids, they are not going to have the same hydrating effect on your body that normal water would. So there are even some drinks that you think you enjoy taking, but actually they dehydrate you further. Your coffees, your sodas, they're not going to really help you in that regard.
How then do we manage this kidney stone thing?
Well, kidney stones, first and foremost, when you diagnose kidney stones, anyway, I'm very careful when people give themselves diagnosis. I hope it is a doctor that diagnosed that you have kidney stones, first and foremost.
Okay.
So, and the only way you can be sure it's kidney stones is you've done a scan and then they've actually seen the calculus in your kidney somewhere. All right. And, they tell you the exact locations of this calculus. Then your doctor would now say, okay, what kind of stones are these? Sometimes it is when you have passed out the stones that they are now sent for investigation to identify the kind of stones. But in some other cases, if you have high calcium levels in your blood, most likely it may be calcium stones. If you have high uric acid levels, and then based on that, we can treat you. There are some drugs that we give to people who have high uric acid levels that can be beneficial, at least so that you're not going to form new stones. All right. And then for the calcium, they will give you diuretics, things that will make you pee. We can give you some things that will make your urinary tracts more open, and then you can let out the stones more easily. But hydration, that is the first line. But in some people, when you have tried hydration and nothing is happening, you've tried other means of treatment, nothing is happening, they may need to go through a process we call lithotripsy, where you use shock waves, to actually crush the stones, and then they are flushed out of your system.
Okay. For everyone sending questions, please, you can also drop this question on Doctor's Mic. Doctor's Mic is on Facebook and Instagram. All right, Doctor's Mic. Just go there. Send your questions there. There are a lot of doctors there, not only Dr. Adeogun. There are a lot of doctors there. There are surgeons there. Doc, help me.
Yeah, there are surgeons there, there are gynecologists there, there are pediatricians, there are people that can help you, give you timely advice. That's the essence of it. Help when you actually need that help. They tell you, okay, this is the route to take. You don't know where to get this done, they can advise you where to get it done. You want a good referral to a good hospital, they can let you know. You want a good referral to a diagnostic center, or you're not sure where to run a certain investigation, you can be guided. And ultimately, of course, if you also want them to actually participate in your care, it's very possible.
Okay.
So Doctor's Mic is involved in that, and also wellness talks, seminars, conferences. We're also engaged when it comes to things of public health significance, helping to create awareness, elaborating more on preventive health, because it's more important for us to talk of prevention now. How do we stop people from getting sick? How do we maintain our health promotion strategies, rather than looking for solutions when the harm has already been done? So we're big on preventive care, and we're big on
you spoke about seminars and all of that. We want to throw more light on that.
Yes, seminars. We are very keen on wellness seminars, corporate wellness, where organizations are concerned about the well-being of their staff. So we're able to come in there, tell them what suits them, as an organization, highlight where the problem areas are for most organizations. Maybe it's burnout, maybe it's mental health, maybe it's the posture at work, ergonomic chairs, comfortable workspace, the ventilation, the spacing out, the exercises, the breaks, the vacations, all these things we try to enforce when it comes to corporate wellness. And then some churches also invite us, some schools also invite us, just like we talked on reproductive and sexual health for adolescents, for young adults. A lot of churches are beginning to be more open towards that. And even schools invite us to talk on substance abuse and how it relates to young people in terms of peer pressure, so that we can counsel them and let them know that this thing is out there in our environment. A lot of things flying around, how do you guard yourself against it? How do you prepare the minds of the young adults to be able to withstand the pressure that is coming externally, that is trying to make them do things that they are not supposed to do, or things that are detrimental to their overall well-being? So we're very big on that, because we, rather than us watch things fall out of place, we're trying to nip it in the bud from the origin, letting people be well empowered and informed. They have the right knowledge against these things, so that when these things come at them, they're able to withstand it, and they're able to tell, especially for the young adults or adolescents, they're able to say, no, I've heard about this is not good for me, this doesn't always end well, and I'm not going to toe this path. So it's very important that schools also collaborate with this kind of initiative, so that this knowledge is disseminated properly.
Not schools alone.
Yeah, not schools, organizations, NGO, estates, anywhere where a group of people are very, they pay a lot of attention to their health, or they prioritize their well-being. They would know that all these are essential services that are very beneficial to them, and that would in the long run help them avoid unnecessary, preventable, complicated cases when it comes to all these things we're talking about. You prevent teenage pregnancy, you prevent abortions, you prevent sexually transmitted infections, you prevent drug abuse and substance abuse, you reduce mental health burden, because a lot of people have mental health issues that are from substance abuse. We know all these things, it's happening in our environment. Right. So but we can curb it and nip it in the bud.
All right, so that's why I said, everyone, if you're listening right now, just go to YouTube. Did I say YouTube? Instagram and Facebook, right?
Yeah.
Just go and type Doctor's Mike. Doctor, right? You know how to spell doctor? Apostrophe S. Doctor's Mike. Mike is MIC. All right.
So comment, drop your comments, your thoughts. We'll be glad to help you and respond to you swiftly.
Or my social handles: Facebook, Instagram, TikTok, YouTube, all of them. Just go to Ikamijude. It's spelled IKAMIJUDEH. All right. Yes. IKAMIJUDE. That is Ikamijude. Just drop a message for me, and then we'll just take it up from there. All right. Yeah. Doctor is also there. Just don't worry. Don't worry. Doctor's Mike or Ikamijude. Like I said, anyone. Facebook, Instagram, TikTok, everywhere. IKAMIJUDEH. And then we'll get in touch with you. Okay. Now, it's just to at least help you out. Now, someone is asking a question. He said, I have a very serious health issue. My prolactin is high, and it has effect on it has affected my breast. Please, what drugs can I take to stop it?
Okay. High prolactin is a situation that occurs in women, and basically it just means that your anterior pituitary, that's your pituitary gland, is secreting excess of that hormone, and that hormone has to do with lactation, milk production. Normally it should start rising gradually during pregnancy in preparation for lactation, but if you find it high when you're not pregnant, then it poses a problem. Then it starts giving you what we call some form of hormonal imbalance and affects your menstrual cycle. You may find out that your menses is not regular like it should be, and you may see your period this month, you don't see it for another couple of months. It messes up your hormonal system, and fertility may become a problem. So in such a situation, there are drugs that we give, and many of those drugs are quite effective. I may not be able to mention
we will not give them free advert at all. Just go to Doctor's Mike, okay?
Yeah. But they're available. They're available and they're quite effective.
Just go to Doctor's Mike. Yes. And so good morning, Doc. Please, I want to know more about prostate cancer and how it will affect someone that doesn't have a relationship.
That doesn't have what?
A relationship. I listened to someone say, if you want to avoid prostate cancer, at least go down like 21 times or 24 times a month with your wife or with your spouse or whoever. That is, have sex for like 21 times a month,
like 80% of the month.
Alpha.
Okay.
So this person is saying, please, I want to know more about prostate cancer and how it can affect someone that doesn't have a relationship.
Okay, prostate cancer is the cancer that affects the prostate gland in males. Of course, it affects only men because they are the only ones that have prostate gland. So basically, prostate cancer it's something of concern, particularly in people who have a positive family history. And then, of course, the risk of it increases as you get older. So if you're a young person, you have no business really bothering your head about it. You can try to minimize your risk if you do have a father or a grandfather or an uncle that has had prostate cancer. So basically, we just advise most men, after the age of 40, go for an annual PSA. Okay. That's a prostate specific antigen test. Normally it should be between 0 and 4, and if it is deranged, if it's not within that range, then it creates a bit of suspicion. Then your doctor, based on the findings of your PSA, would request that you go for a biopsy. If it is markedly elevated, you go for a biopsy. Nobody ever gives a diagnosis of cancer without a biopsy. So you have to first do a biopsy, then the biopsy confirms that it is cancer, and then even the biopsy doesn't just take just one portion of your prostate. It takes multiple sections of your prostate gland so that they are able to have as much tissue to work with, and then through the histology they are able to analyze the tissue and find out if there are cancerous cells there. And if there are cancerous cells there are different modalities of treatment available. But for you as a person who says maybe you are not in a relationship, I can tell you that even men that are polygamous, that have 10 wives, can still come down with prostate cancer. So so don't tell me that it's the number of sexual intercourse that you have that will protect you. That alone would not do the magic. So you have people who are polygamous who still have that. So it's very important that you go for your timely screenings, and your doctor does also what we call a digital rectal examination, to use a gloved finger to feel and palpate your prostate. If your prostate is hard and nodular, it can tell us that, you're probably dealing with prostate cancer here, and then you go for a biopsy. But a biopsy alone confirms the diagnosis.
Thank you. We have less than 15 minutes to run. As I said, everyone just get to social media and just join us there. Hi, good morning. I have been listening to your conversation about masturbation, and I am a victim of it, and I don't know how to stop it. I didn't say my name because I don't want you to mention it in public. Sorry. No wahala. But how can you help?
Okay, first and foremost, if you want to overcome masturbation, you know yourself best, So you would need to look at what are those things that prompt you into doing that. Is it loneliness? Is it when you are idle? Is it when you are not actively engaged in anything? Is it when you are not productive? A lot of people use it as a pastime. A lot of people use it to relieve stress in some cases. So a lot of factors, come to play when it comes to masturbation. And if you really need to get intimate, maybe it may be time for you to settle down. Maybe you should find an actual partner and settle down. But if you catch yourself doing it more when you are idle, then get busy. If you find yourself doing it more when you are lonely, then be in the midst of people, responsible people, not people that will further, worsen what you are going through or what you are trying to run away from. You can't want to stop drinking and you meet yourself in a beer parlor, you're not going to help yourself. Then also you try as much as possible to make sure that you stay away from pornography as much as you can. All right, that would also help you. I hope this helps. And of course, with prayers, nothing is impossible.
All right. If just a quick one here, if the BP drugs is causing too much urination in the night, can one change to another drug?
Yes, absolutely, yes. Because there are some drugs like I said, diuretics. Diuretics are important, especially for black people when they are controlling their hypertension. So if it becomes a source of problem for you, you need to speak with your doctor. But you did not specify if you are male or female. Mind you, you may also have prostate issues if you are a man. If you are a man, you may have prostate issues alongside the effect of your diuretics that you're using. So you really need to be sure what is causing what exactly. All right? So you need to speak to your doctor if you are urinating more than usual. Urinating more than usual can be a sign of high sugar in your blood. It could be a sign that you have a UTI, a urinary tract infection, and it could also be a side effect of medications like antihypertensives, and it could also be that you have a prostate-related issue like prostate enlargement. So you can see that multiple things can mimic that, but you need to have your doctor investigate you and let you know what is really happening to you. And if it is your drug that is giving you so much concern, they can switch you to another drug that will probably have less effects. producing that.
My nephew, who is 25 years old, complains of forgetfulness, not remembering it, not remembering.
That is how old?
25 years.
Okay.
Not remembering things. I've asked if he takes substance or any at any time. He said he never did. Would he be lying, or is it depression? You know, what is it?
Well, a number of things can cause forgetfulness, but he's still young. He's not typically expected to have memory issues this early. But sometimes when people are hypothyroid, if you have hypothyroidism, you may begin to have some forgetfulness. So he may need to go for a thyroid function test, especially if he is gaining weight more than usual, if he has become unusually sluggish, if he has become cold intolerant, having dry skin, more constipation and all those things. It may point to hypothyroidism. So I would advise that he goes to check his thyroid function, do a vitamin B12 check, and then ultimately ask about his sleep pattern. What is his sleep like? Because it is when you sleep that all the things you learned or all the things you've come across during the day gets consolidated in your memory. So without good quality sleep, your memory would not be the same. You notice some memory decline, and then ultimately, you have some degree of forgetfulness. So you need to ask all these important questions.
Good morning, doctor. Please, is it advisable using sexual medicine always before sex?
It is never advisable because if you're always using that, then you are not allowing your body to perform optimally like it should. Maybe occasionally you may need it for one reason or the other, under the supervision of a medical practitioner. Maybe a medical practitioner says for this reason or for that reason, you have to be temporarily on this medication. You should stick to that prescription for the duration of time recommended, and you stop it. But when it now becomes habitual and continuous, not only are you going to build tolerance to it and you require a higher dose to produce the same effect, you would also run into much problem because your body would not be able to function on its own as it should. So please don't self-medicate. And if you have erectile dysfunction issues, the problem may be deeper than you think. It's not just you taking some drugs. You may be diabetic, maybe a side effect of other medications. We've talked about erectile dysfunction over and over again on this show. You need to find out what is the true cause of erectile dysfunction and nip it in the bud. That's the only solution.
Okay. Someone sent a message. He said, please, without alcohol, I can't perform very well on bed.
No, I think that is your own notion and what you are used to, because the truth is nobody was born with anything. All these things are learned behaviors, and you can actually unlearn them. I would tell you, for free, that if you continually indulge in alcohol on the basis that is the only way you can perform, your kidneys are at risk, your liver is at risk, your heart is at risk, because alcohol has been shown to give you no health benefits. Because you're going to be running the risk of many problems. Because what is the use of you having a good sexual life and your liver packs up in the process? So you need to choose wisely. You need to find out why you're not performing. Go to the root of the erectile dysfunction, and this can only be done through proper consultation with a doctor. The doctor will ask you relevant questions, send you for relevant investigations, and nip it in the bud. That's where the solution lies.
Okay. Because of the time, let me just read this quickly. I believe that the only thing that can lead a married man to masturbation is a situation where the wife doesn't allow her husband to have sex with her, and I'm a victim. Not having sex, not having access to have sex with my wife at all. I don't masturbate, but usually go outside to settle myself, and my wife is the cause of my going out. Can you believe that for the past 5 years that my wife has been denying me sex? 5 whole years, dog.
So you and your wife need to see a marriage counselor.
That is it.
And then after seeing a marriage counselor, both of you also, I don't know what religion you practice, you should also see your religious leader who is able to further give you guidance from a spiritual perspective and let you know why it's important for you to be faithful to your marital obligations.
Okay.
Because the truth of the matter is that you run the risk of infections, you run the risk of some terrible diseases, which at the end of the day ultimately can ruin your family. And when that happens, who do you have to blame? even though you say somebody has deprived you of sex, but that person is not the one who is going to live with that disease. It will be you, because if that person continues denying you, that person will be safe from the illness, but you will be the one to bear the brunt and the consequences of it. So you need to make healthy decisions. If you know you are still interested in that marriage, then both of you should work towards salvaging your marriage by seeing a marriage counselor.
Okay, someone is saying on YouTube, is saying, please send me the doctor's mic link. Okay, see, just go to Facebook and go and search for doctor's mic, or Instagram. That's the only place you can get it. Instagram or Facebook. Doctor, you know how to spell doctor, right? Just put apostrophe S. Okay, apostrophe S. That doctor's. Then mic is MIC. Doctor's mic, and you're just there. Or, like I said, just go to Ikami Jude. Yeah, I will link you up. Okay, is that fine? Don't worry, you have a lot to learn. But I don't know how to say this. It's fine. Just go to doctor's mic, and we're good. Thank you, doctor. We have to go on.
Thank you for having me.
We have to run. Ikamijude spelled IKAMIJUDEH. It's just one word. IKAMIJUDEH. I love you all so much. Okay. Well, do have a wonderful day today. Good morning. Up next is the news at 12.